Very often you ask me what to choose, surgical lifting or endolift, which I call the biological lift. Of course, this is a very important question, but it all depends on you, the patients, and what kind of result you want to achieve. A surgical lift is performed by a surgeon in an operating room and involves a long recovery period. Of course, it can be divided into different types of lifting: full, partial, but generally it always involves cutting the skin, tightening the tissues and fascia, and then stitching it up. In the case of a surgical lift, it is necessary to use sutures because we have cut the skin and simply need to connect those pieces of skin together. As a result, there has to be significant swelling, there must be a recovery period, and of course, we achieve certain results. These results will be spectacular, of course, depending on which type of lift we are dealing with. Surgical. In the case of endolift, the procedure is completely different because we heat the tissues. In other words, we strongly stimulate our collagen, forcing it to produce new collagen, our fibroblasts. And in this way, we want the internal processes, our own body, to generate this lifting effect. That's why I call it a biological lift. If we compare the effectiveness, which we want to measure in centimeters, it's obviously very difficult. It's hard to measure, unlike in plastic surgery. However, many patients appreciate natural treatments, treatments that involve regeneration, which result from the activation of our body's natural processes. And one such treatment that falls within this trend is the endolift treatment. Another thing is that Endolift has medical procedures that were developed by plastic surgeon Dr. Riccardo Forte. He is a plastic surgeon from Milan. He also has his own clinic on Lake Como near Milan, you could say so. And Ricardo Faut, as a plastic surgeon, created the Endolift and Endolift X procedures. Endolift X is already a very powerful procedure, which of course will not replace surgical lifting, but it somewhat imitates it by very strongly, already maximally, stimulating our skin to produce collagen and removing excess fat tissue. Of course, the choice of procedure depends on our life philosophy, on which path we want to follow. Many patients begin their journey with lifting by starting with endolift, hoping to delay aging and to start their experience with lifting at a slightly later time. Therefore, as I mentioned, to sum up, endolift is a biological lifting procedure. It cannot be equated with mechanical lifting, such as surgical lifting, but it is a procedure developed by a plastic surgeon from a medical perspective. The procedures were created by the plastic surgeon, Dr. Ricardo Fort. Therefore, remember that doctors who are trained are listed by the manufacturer, Euphaton. You can find them on the official website of Euphaton. These doctors perform the procedure according to the recommendations and will also advise you on what to do. Should you have a surgical facelift or the procedure, Endolift will be the best option for you. Schedule a consultation. Doctors are available all over the world, and I think they will be more than happy to discuss with you which path you should take.